This conference will now be
Hello and
recorded.
welcome to the pre-op nutrition class. My name is Victoria. I'm a registered dietitian, and today I'm going to cover information that is really important to know before your bariatric surgery and then the diet progressions after your bariatric surgery. So let's begin with the pre-op diet. This diet occurs 2 weeks before your surgery. So once you get a surgery date, you can count back and determine when to start this diet. So the purpose of this diet is to shrink the liver before surgery to decrease complications, make it easier for the doctor to get to the stomach past the liver. Essentially, the diet is low calorie, low sugar, and low fat. And what this does is, because it's low calorie, the liver, which holds sugar, releases the sugar because to give you energy throughout the day. What it consists of is basically 2 meals are replaced with a protein and a fruit. And then you get one real meal, so to speak, which is a portion of protein, a fresh vegetable or cooked, and a starch. The lunch and the dinner, by the way, can be switched out. So if you prefer for your real meal to be dinner, if that fits your schedule better, that's absolutely all right. So the foods that you do want to eat when you're on this diet for your one meal of the day is lean protein, usually poultry, egg whites, Greek yogurt is fine. You have a carbohydrate on the plate as well, which would prefer to be non-refined, something with fiber, whole grain, brown rice, corn, wheat bread, complex carbohydrates basically. Of course, vegetables are fine as well. You're allowed to put a little bit of oil on it. And basically, you're basically drinking mostly water and sugar-free beverages because at this point you want to already avoid carbonation and be ready to stop caffeine. The foods you want to avoid, a lot of this consists of condiments. So you have your high-fat condiments, your mayonnaise, your dressings, your butter. Then you have your high-sugar condiments, the ketchup, barbecue sauce, honey, things like this. You definitely want to avoid energy drinks, again, the caffeine and the seltzer as well. Also, if you are feeling like you want to nibble on something between the shakes and the one meal you get, you are allowed to have vegetables, either raw or cooked without oil, or also sugar-free popsicles and sugar-free Jell-O. So now a week before surgery, it's always important to remember that the doctor instructs to stop taking non-steroid inflammatories. So you have your Advil, your Aleve, your aspirin. This is to decrease chance of bleeding during surgery. You are allowed to have Tylenol. Also, if you're taking vitamin E or fish oil supplements, you would stop those as well. This is also a good time to make sure that you have proper equipment in your kitchen. I specifically make an emphasis on measuring cups and also a blender for phase 3, which is the purees. So the clear liquid diet is something that you start one day before your surgery and then about 5 days after surgery. This is basically, again, sugar-free, Jell-O, popsicles, broths are really good at this time, herbal tea without caffeine. Also, you could do decaf, you could do decaf coffee, decaf tea, and also clear protein drinks like the Protein 2.0 and a few other brands out there are also allowed and encouraged for you to start getting your protein needs. If you are not able to consume a lot of the protein drink, that's okay. Your focus is on hydration these first few days. It's really, really important to be sipping fluids all day to prevent dehydration. The only difference between the clear liquid diet one day before surgery as opposed to after surgery is to avoid purple and red colors, just in case they would appear as blood in the, in the surgical equipment. After surgery, you're welcome to go back to the reds and the purples. They do taste the best, especially the reds. Also, the day of your surgery, so this is a day after you have been drinking clear liquids all day, you will receive a beverage. It's an insured beverage. You're going to receive it during pre-admission testing. And this beverage, the purpose of it is to improve surgery outcomes. So essentially, hopefully you'll feel less thirsty, less hungry after surgery, also less nauseous. It also, with diabetics, it helps control blood sugar as well. So the instructions that you will receive for this beverage is if you are diabetic, you drink it before bed the day before your surgery. If you are not diabetic, you would drink it 1 hour before you head out for surgery. I also highly recommend to refrigerate these kinds of products. They always taste better. Do not eat or drink anything else the day of your surgery besides this beverage. Small sips of water probably are allowed, but mostly nothing else. So now you've had the surgery, you are in recovery. Ideally, you'll only spend 1 night at the hospital. So basically, you're going to receive a tray from the hospital's kitchen. And this is a standard tray that the hospital provides for clear liquid diets. So you're going to get your jellos, you're going to get broth, decaf tea and coffee, of course, water. You're also going to get an Ensure clear protein beverage that you can drink. You may want to dilute it with water if it's too sweet. And essentially the goal will be to sip one of these 30 milliliter or 1 ounce cups every 15 minutes. You can pick anything that's on your tray, and essentially you want to consume 4 of these an hour. So right now that does not seem like a big deal. It's pretty easy. After surgery, you may find that this amount is a little bit more challenging. So again, you will be sipping all day. They will also have you walking around the hospital unit, and this is to promote blood flow, healing, also to get rid of some gas that's trapped up here after surgery. That's just how it's done. Again, you're sipping constantly to avoid dehydration. Because your stomach is small, you can't just, drink a whole cup of water to relieve thirst. You have to do small sips throughout the day. So dehydration can easily occur after bariatric surgery. It's also the #1 reason people get readmitted to the hospital. So we want to avoid this and start sipping. So when you are home, you continue the clear liquid diet for about 4 or 5 days. So your portions have now increased from a 1 ounce to a 3 ounce cup. So basically, again, nothing's changed. You're still allowed to drink the same things. In the book, there's every diet is described in terms of what it consists of. And then on the next page, an example, and this is every day you would have something every 2 hours, and there's example of that. The other thing that I like that the book has is there's a color-coded calendar here, and you're going to receive a copy of this in the hospital as well. Each color represents a diet. So once you get a surgery date, you can start populating the dates. You basically start up here with your surgery date and you move forward. And this chart allows you to easily reference which day is it of what diet and how many more days do you have until the next diet. So it's very convenient. I recommend to post it on your refrigerator, somewhere in the kitchen, somewhere where it's visible. Your goal will be to consume 64 ounces of fluid a day. This is 8 cups. This is going to be a number that will be recurring, that you're going to hear a lot, because it's always going to be the goal. So next we have stage 2. This is where dairy comes in. Your options for what to eat have greatly increased. This is also when you start taking your chewable vitamins. So essentially, you can now start on the more substantial protein drinks, which will be very important to help meet your protein needs through the whole month, really, after surgery, as you're slowly reintroducing food into your diet. But meanwhile, on stage 2, full liquids, this is about an 8-day stage. You can start having light yogurts, no Greek yogurt yet, but light yogurt is fine. Cream soups, basically any kind of milk, preferably low fat. You could also have the milk alternatives, you know, the almond milk, the soy milk, any of that. So you could do cream soups, you could still, of course, do the broths. Anything that has particles, like the soups, maybe the yogurt and the fruit, needs to be strained out. So your goal, again, 64 ounces of water a day, 70 to 90 grams of protein a day. Now, this is when you actually are able to meet your protein needs and when you want to start keeping track of that. Next, we move on to stage 3, pureed foods. Basically, as the name suggests, everything needs to be pureed. Vegetables, cooked, pureed. If you are not really into pureed meats, there's always dairy food to fall back on. You can now start having Greek yogurt, cottage cheese, ricotta cheese. You can also do low sugar pudding with flavorless protein powder. You can also put flavorless protein powder into hot cereals, such as cream of wheat. This is also a good phase to start eating scrambled eggs. Those don't have to be pureed, they're actually soft enough. And fish, as long as it's not breaded or fried, is also soft enough to eat. This is where it's really important to start implementing the habits that we discussed earlier on in our sessions, which is basically chewing thoroughly and not drinking while you eat. Following puree, we have soft foods. I also nicknamed this the overcooked phase. Basically, everything you want to be super cooked, particularly vegetables. I like frozen vegetables because they're already cooked, so they're not very hard to further prepare. Also, meat, you want to cook in some kind of liquid, whether it's a broth or a stew. That's also a really good time. You could also start increasing the fat content a little bit, maybe have some avocado. Canned soft fruit is good. But mostly everything canned except bananas. Again, you're still drinking your protein supplements because each food takes a little while to introduce. You want to introduce it slowly, gradually, to see how your body responds, because you basically have a new stomach. Again, water needs are always going to be 8 cups. Protein needs are always going to be 70 to 90 grams a day. And finally, we are on stage 5. About a month has gone by and the food is technically regular. However, there's definitely things to still be careful about. You want the protein to be lean. You still want the vegetables to be cooked pretty well. And you want to be cautious of raw fruits and vegetables at this time. But whole grain breads and, you know, any kind of grains are really good for you. The foods that may be a little bit problematic are partially foods that are not extremely healthy anyway, like, you know, doughy breads, white pasta, white rice, high calorie sugary desserts. Super high fat foods are problematic as well. And also dry meats, even chicken can be a little bit difficult. So either chewing thoroughly or again cooking in some kind of liquid is important. Some foods only in the beginning will be a little problematic, and eventually you will be able to eat them and they're healthy. And this again includes raw fruits and vegetables with skins, seeds. You want to slowly introduce that, and we can talk about that individually in your sessions after surgery. You also want to be careful with popcorn, various kinds of nuts, you know, because the sharp content can kind of hurt the stomach as well. And in some cases, highly seasoned and spicy foods is a little difficult in the beginning, but those things are short term, 3 to 4 months. You will eventually be able to eat those again. So again, you want to introduce one food at a time. You want to be slow, careful about it. Supplements, if you find yourself able to eat protein, you want to wean off of the supplements. Drinking your calories is always a secondary choice to actual food. And you want to continue to add variety to the diet, but very slowly. And essentially, you go for the protein first, the non-starchy vegetables second, and then finally the starch third on your plate. As we discussed previously, protein is the most important nutrient after bariatric surgery that you really want to make sure you do not become deficient. So some common inconveniences, complications is there's gas and nausea typically in the beginning. Gas, you just have to walk it off, give it time. Nausea should go away pretty quickly too. I recommend drinking cold beverages and just whatever you can, don't force anything. Constipation, there's always a chance that'll happen because you're really not eating much substance and there's been changes in the GI system. So you're allowed to take a gentle stool softener, milk and magnesia, Colace, Metamucil, things like that. So dumping syndrome is what happens when somebody eats something that's way too high in sugar or refined carbohydrates. So again, the desserts, the doughy breads, and eats it too quickly. So protein normally should not cause this. Dumping syndrome typically happens when there's an overabundance of sugar in the body, and the new new stomach and the digestive tract just can't absorb it. So it pushes it through very quickly, very painfully, as you can see the signs and symptoms. And basically to prevent this, you again follow the rules. Small frequent meals, don't eat and drink at the same time, avoid simple sugars and refined carbohydrates, which essentially are simple sugars as soon as you bite into them. So the long-term diet, how things will look in the future is you'll be eating about 1,000 calories a day, plus minus 200. You will always want to have 70 to 90 grams of protein. The carbohydrates and the fat, as long as you will fall into place on their own, as long as protein is your priority. The rest of your calorie allowances will go to the fats and the carbs, which you will only be able to eat so much. You will always need 8 cups of water a day, which you will have to drink evenly throughout the day. And of course, your vitamins are also something that you will essentially consume for life. So really the name of the game with bariatric eating habits is small and frequent when it comes to both food and beverages. So the tips for long-term success, they're more like rules. It's everything that, I keep repeating, the high points, the amount of protein you need, the amount of water, the thorough chewing, the smaller portions. You want to eat at least 3 meals a day, preferably 5, because your meals and snacks will essentially turn into the same thing. Your quantities will be, this is about half a cup. In the beginning, you will only be able to eat 1 of these. Eventually, you may be able to eat 2 of these, but no more than that. Basically, avoiding skipping meals is very important, and protein beverages are always there for you in case you need protein, but again, you want it to come from food. And of course, after surgery, you have a lifetime membership to see me whenever you'd like. We have a minimum recommendation schedule, so 2 weeks a month, 4 months, 6 months a year, but you can switch it up to how you would like to see me to touch base. So essentially, we're all here for you. The team is here to help you at every phase of this process. And basically, I wish you luck. I think you'll do very well as long as you follow everything that we talk about, and we are here for you whenever you need help. So now I will open the floor to questions. Thank you so much.